diets and how to manage a patient under ketogenic diet who are seen in the emergency department for any other reason. So if we go back in time, we can go back really long in time to Hippocrates, and it was the first who used starvation to treat epilepsy. And it's also documented in biblical times. First modern use of the starvation or ketogenic diet, or it was initially starvation, was reported in the early 90s by two French physicians. They reported 20 children and adults with epilepsy. They were treated with success, both on the seizure frequency and the cognitive improvement. In the same time, in the US, also reports showed benefits of 3 days to 3 weeks fasting to cure many diseases, including epilepsy, with also a positive effect independent on the cognitive improvement. These studies, they were studies back then, they already showed that this effect of the starvation was mediated by the change on the metabolism. Mainly, we force the body to burn acid-forming fat instead of glucose. After that, they utilized acetone and beta-hydroxybutyrate in normal subjects when you put it on starvation, or when you use a low-carbohydrate fat or a high-fat diet. That leads to the development of ketogenic diet as we know it, in order to obtain the same benefit of starvation but for a much longer duration. It was largely used and reported in all therapeutic manuals between 1990 and 1940 until the first anti-epileptic drugs was discovered, the phenylnephrine. And after that, the ketogenic diet was slightly put aside in the development of all the anti-epileptic drugs until it was rediscovered in the 90s with some successful report of efficacy and also an important role of parents in promoting this kind of therapy for their children. It is now widely used, and there's a publication reported being used in over 45 countries back in 2005. I think it's much more nowadays. There are many publications, more than 40 per year, related to the efficacy of ketogenic diet. It's not only restricted to epilepsy, it has also role in other indications. And the main problem remains in epilepsy that it's always considered as a last choice therapy, and maybe this can be improved. So what is exactly the ketogenic diet? It's a high-fat, low-carbohydrate, and liquid protein diet. Mainly, we give 1 gram of protein per kilo of body of weight in children per day, and 10 to 15 grams of carbohydrate, and the remainder of calories intake of the day must be given by fat. There is a many version. The classic version is the ketogenic diet with a 4-to-1 ratio. That means for every 4 grams of fat, we have 1 gram of combined protein and carbohydrate. Nowadays, we know 4 types of ketogenic diet therapies. The classic one, using the long-chain triglyceride. The medium-chain triglyceride diet, which allows to introduce more carbohydrate and more proteins because medium-chain triglycerides gives more ketone per kilocalorie of energy, but it has also more side effects, and it cannot be used in infants and in children receiving valproic acid. We have also the modified Atkins diet. We give basically 10 to 30 grams of carbohydrate per day. Fat and proteins are not restricted. This diet is easier for parents because they don't need to measure it, they don't need to weigh every element they give to the child. And last, we have a low glycemic index treatment. 60% of the energy comes from the fat, 30% from the proteins, and we allow 40 to 60 grams of carbohydrate, but the index glycemic must be low. It's not, it was widely said that we cannot use ketogenic diet for infants below 2 years of age because of growth problems, but European recommendation since 3 years proved that it is efficacious, and it is also possible to use the ketogenic diet for these for children as young as 2 months of age by using special formulation and given a ratio that would not be above 3-to-1 for the classic ketogenic diet. So here's a little reminder. So we can see in every ketogenic we can see that the carbohydrate is really limited. It's the enemy, the ketogenic diet. It must not overcome 10% of the daily caloric intake of the child. The main indication, if we take a look at most updated recommendation on the use of ketogenic diet in epilepsy, these are the indications where there is strong evidence of benefits from this therapy and from an early use of the ketogenic diet. I will briefly review some of the indication and some of the literature that prove these points. The first one is for the myoclonic atonic seizures, or as known as dose syndrome. As you know, the dose syndrome is an epileptic encephalopathy that associates in children between 2 and 4 years of age, mainly boys. They start to have generalized tonic-clonic seizures, and then they have atypical absence. They have myoclonic atonic, they can fall, they can hurt themselves. They have generalized and tonic-clonic and tonic seizures, mainly during the night. It comes with behavioral troubles, it comes with sleep troubles. And there are many studies, retrospective studies, that show that ketogenic diet introduced really early can really benefit to the children. And we can see that significant introduction of an early moderate ketogenic diet before giving too many anti-epileptic drugs is really significantly associated with an improvement or even a seizure-free evolution in these patients. It is not specific to classic ketogenic diet. It was also reported with modified Atkins diet. I was speaking about infants before. Infantile spasm is also can be sometimes challenging because it's pharmacoresistant, because patients, they have aggression, they have hypsarrhythmia, the cognitive development is impaired, so it's really important to treat them and to treat them fast. And again, in these patients, even if they are young, less than 2 years, the ketogenic diet has been proved to be efficacious. On the long period, you can see here over 12 months of follow-up and retrospective review of 33 infants. And two of them were given the PT as first treatment. It's not the classical recommendation, but it is possible to start with the ketogenic diet in these patients with a good response. Here are other series that are reported, and to see that we can have more than 50% reduction in the seizure rate within 2 months, which means it doesn't need to wait a long time before it has an efficacy. The use of a formula adapted for infants, such as ketogenic, can really help in this category of age. This is another series of 104 infants that were started on the ketogenic diet, and we can see also that there are over 90% spasm reduction, and the effect was maintained during the time. Tuberous sclerosis complex can be also a good indication. It's a neuroacademic disease that associated multisystemic signs. It can affect children by the presence of the tubers with the presence of an epilepsy that can be pharmacoresistant. We can have 3 kinds of seizures in this pathology: infantile spasms, we can have vocal seizures, and we can have Lennox-Gastaut syndrome evolution in older children. And many reports, we have put here some of them, reported an improvement with the ketogenic diet in these patients. It can really help, if not on the long term, but at least to try to control when the situation is really going bad. Dravet syndrome is also another epileptic encephalopathy characterized by febrile status epilepticus that start in young infants and evoluting with febrile seizures associated with a decline in the cognitive development. These children are, most of them, pharmacoresistant, and the ketogenic diet can really help. Here's a prospective study that shows the majority of the patients were responders to the ketogenic diet. And it's also some publications show that there's an independent effect on improvement for the cognitive evolution of these patients with the ketogenic diet. This is rare conditions, but it can be devastating for the children. It's the fires or the Norse conditions. There was a critical review that was recently published, and ketogenic diet is reported in the literature and case reports as being efficacious in nearly 50% of these patients. And it's important to introduce it early when you have patients that have a sense epilepticus that does not reply to the classical drugs, Desolan or phenobarbital or others. What about metabolic disease? My colleagues have talked a lot of them. There are three main indications for the ketogenic diet in metabolic disease: glucose transporter 1 deficiency syndrome, pyruvate dehydrogenase deficiency, and mitochondrial disease. But it is also important to note that there are absolute contraindications, because all the diseases that can affect the metabolism of the carnitine or the metabolism of the acid-carnitine or the beta-oxidation, this contraindicates the use of the ketogenic diet, because these patients cannot stand the fasting and they can die if we apply the ketogenic diet in these. So it's really important to have a metabolic workup before initiating the ketogenic diet to rule out these conditions. This is a reminder why it is important, because this is the normal metabolic with the regular diet. It is the glucose goes straight to acetyl-CoA and it is used in the Krebs cycle. But when we give mainly triglycerides, it returns to fatty acids and then it will be oxidated to provide acetyl-CoA. So if there are any problems on this pathway, it will lead to a catabolic crisis if we give ketogenic diet. I have highlighted a little bit the GLUT1 deficiency syndrome, because this disorder is characterized by a mutation in this transporter that brings the glucose from the blood to the CNS, and when it's mutated, when the gene is mutated, the transporter is not working, so glucose cannot cross the barrier, the blood-brain barrier. So we have hypomicroalgia and we have symptoms like epilepsy, developmental delay, complex movement disorder, and microcephalia. For these patients, the treatment is a ketogenic diet. So this means these patients are going to be practically their whole lifetime on this treatment, because it is the therapy to reverse the lack of glucose in the brain. So when we think about giving the ketogenic diet, starting a ketogenic diet for a patient, we need to ask some basic questions. Is there a medical indication? Basically, there are no epileptic encephalopathy that cannot benefit from the ketogenic diet, either on early or on long term. But it's important to rule out the contraindication, as I said before. The motivation of the parents and the caregivers are really important, because they are the ones who are going to repair the needs. They are the ones who can prevent the child from stealing any glucose or any sugar or any prohibited alimentation. So it's really important to take time to inform the parents, to explain to them how to do the calculation, how to give the ketogenic diet, how to calculate everything. We need to see how the child is fed, testosterone, nasal tube, or ordinary fed. If we have behavioral troubles, autistic syndrome, or any other behavioral troubles, we can affect the effect of following up the ketogenic diet. What are we expected from the ketogenic diet, and on what term? Is it really seizure-free, or just an improvement, or do we try to take off anti-epileptic drugs by using the ketogenic diet? So it's important to set down the objectives of the parents and what are the burdens of the treatment. It is important so to have a good start with the parents, to really take time to explain to them everything, and then to have regular follow-up and regular contacts with the parents, between the parents and the dietitian team or the nutritionist who's going to take care of the patient during his period of ketogenic diet. It's important to do blood tests and metabolic evaluation before initiation and during follow-up on a regular basis, to check out for anti-epileptic drugs, their posology, the genetic form, because they can contain carbohydrate, and this can affect the amount of carbohydrate you're going to give to the child, and evaluate the growth curve for the patient who are on long-term ketogenic diet. If a patient under ketogenic diet presents to the emergency department with subsequent illness or any other problem like fever or gastroenteritis or anything, it's important to check these points with the parents. Is he still on ketosis? Is it just a test? It's really rare that we must not use glucose for this patient. If they need perfusion, only saline and intravenous perfusion. Monitor for hypoglycemia and try not to stop the ketogenic diet because it's like discontinuation, brutal discontinuation of an antibiotic who can have a status epilepticus and it can be dangerous. So it's really important to maintain the ketogenic diet as possible in these emergency conditions. Thank you very much.